Good evening, everyone, and welcome to our Fireside chat series. This is the Long COVID Clinic, What You Can Do, with me, Dr. Binita, Kane, and
myself, Helen, Oakleigh, co-host and one of the founding members of the charity Long COVID Support, and passionate chronic health lost the word. I could say ambassador then, advocate. And
that was in true patient style, losing the words halfway through a sentence. Helen, you did that beautifully. So this evening's session is going to be about debunking myths of the mind-body connection, and I will be introducing our guest very, very shortly. Please remember that the session is live and interactive. You can post your comments and questions in the chat. Helen is going to be heading backstage now and is going to be keeping an eye on the questions, and we promise we will try and get through as many as we can towards the end. So usually the last 20 minutes we dedicate to the audience questions. So Helen, we'll see you later on. Thanks very much. And without further ado, I'd like to introduce my guest for this evening, who is Nadyne McKie. Nadyne is a recovery-focused therapist specialising in long COVID and other chronic conditions, and the author of the book Breathe, Rest, Recover, which is all around long COVID recovery. Welcome, Nadyne. It's really great to have you here.
Thanks, Vinny. It's really nice to be here.
Yeah, so this session, I was really keen to do this session because this is potentially a controversial topic. It shouldn't be, for all the wrong reasons. As a doctor, I have always treated the whole person, and that includes the mind and body, because we can't differentiate mind from body completely. So whether I've been treating severe asthma or autoimmune conditions or chronic inflammatory bowel disease, that's always been my approach. I think the difference in long COVID and ME is that these approaches have been bastardized in a way, because so many patients have been gaslighted and they've been told that their symptoms are in their head. They've been offered BT as a cure. They've been told to push through, go and get some fresh air, think more positively and you'll just get better. And so and many people have tried mind-body approaches. It works for some people, and then for other people, 3, 4, 5 years later, they're still really poorly and getting no medical help. And so I was really keen to do this session with an expert where we can start to dissect what's going on here. How do we use these approaches to help recovery, and what are the big myths? So it would be really great if you could just tell us a bit about yourself, Nadine, and how you've got into this space.
Yeah, sure. So as you said, I'm a recovery-focused therapist. I've been specialising in long COVID for 5 years now. And alongside that, I've spent 5.5 years in NHS acute mental health services, as well as running private practice too. The reason that I'm very, very passionate about this condition is because I myself have a history of post-viral fatigue from my teenage years. And I developed long COVID from a COVID infection in October 2020. And also my son has long COVID, so I care for my child with long COVID. And for any parent out there who is doing the same, they will know how we become, as Helen was saying, I always think avocado, advocating, but yeah, advocating for your child or anyone you care about with this type of condition is absolutely exhausting, because of all those things that you've just mentioned. This is very much a condition that has historically been dismissed. People have been sent down treatment pathways that aren't helpful for this condition, which is a very real physical condition with physical symptoms. And I think that is, for me, in the area that I work in, one of the main reasons why I really am very, very passionate about working with this condition to support people's recovery, because there are elements of how people are historically treated and how that actually affects people now that really do matter, and we need to address that. And I find myself apologising, not that it's ever been my messaging, but I end up apologising for the kind of historical aspect of this condition and under ME and chronic fatigue.
Yeah, absolutely. So let's just dive straight in, really, because one of the things that happens to patients when they go to a standard sort of NHS clinics, they'll have a whole rack of tests. And we're great in the NHS. If we find something wrong on the test that we understand and fits into a box that we recognise as doctors, we can do something about it. So when healthcare works, it works really, really well. But chronic disease, unfortunately, usually doesn't fit into a box. It's not something that has been well researched. It's not something, certainly post-viral illnesses are not stuff we are taught about. So patients get this message that your tests are normal and therefore there's nothing wrong with you physically. This must be anxiety related, and these are the things you need to now go and do to get better. And of that, one of the things usually offered is psychological support, which is usually in the NHS in the form of CBT.
Yeah.
Let's unpack. There's a lot there, isn't there?
We might need to unpack that. I mean, I think the first thing is, yes, absolutely. When tests come back normal, when test results come back normal, if diagnostics don't show the things that the parameters of our diagnostic testing within our healthcare systems can see, then so often people's symptoms are dismissed. And I think it's really important. I always say this to people, they are the most wise people in the room about themselves, because they're with themselves all the time. They know their experience. That being said, I think it's really unhelpful to tell people that things are in our heads, because it doesn't really address what's essentially going on. It just kind of goes, you're making this up, or this is something that requires a psychiatric kind of approach. And actually, I think we really need to move away from that framing and get really into the heart of understanding what's going on for the person, rather than just only looking at the diagnostics and going, well, there's nothing there that we can treat with our treatment pathways. Because actually, a lot of people really need that kind of understanding and acceptance that there is something going on.
And actually, I'm just going to caveat all the normal tests with a massive, we're not doing the right tests, by the way, and that's why they come back normal. Yeah. And even normal tests that are reported as normal are often not normal when you look at the raw data. So I'm just caveating.
Yeah, and also what's normal for one person doesn't necessarily mean that's normal for another. And it doesn't take into account how we live our lives, our past experience, and how that might have shaped certain things like our nervous system response to things, and how we might actually feel dysregulated in certain situations. It doesn't take into account the whole person. And I know that there's various reasons, and we could go off on a massive tangent about why healthcare needs to be more holistic in its approach. But for this condition more than any, this is why I'm so passionate about it, because I really truly think we do need that holistic approach within this condition.
We do, but we need that in every chronic illness. So, my severe asthma service that I was part of for a number of years had 2 psychologists attached to it. Transplant services have psychologists, cancer services have psychologists. It's an integrated part of looking after ill people in any other condition, but there is no other condition where psychiatrists run services for physically ill patients. It's really bizarre, and there's a long history of why this has happened in ME, which we haven't got time to go through, but very briefly, psychiatrists got hold of the diagnosis in the 1970s and then just pushed this agenda about, this is all fear of exercise, this is all fear-based, people with poor illness, but behaviors and beliefs, they're not believing they can get better, therefore they can't get better. They need to get out, exercise more, and then that permeated medicine for decades, and it still does. Yeah. So let's get into the science of it. We want to talk about neuroscience. We bang on about the autonomic nervous system a lot on our live streams because it's relevant to
very relevant to
every chat we do.
Absolutely.
Can you talk about, just briefly for people who may not be familiar with the autonomic nervous system, what that is and why the neuroscience and the recovery focused approach has got to consider the autonomic nervous system?
Yeah, I think the thing, specific to long COVID, obviously, dysautonomic symptoms are really very real and they're very felt in the body.
Should we just explain what that means? Because some people watching, lots of people will know what that means, but some people might not.
So dysautonomia covers symptoms such as dysregulation of the nervous system. The POTS type symptoms as well come into that bracket, that category. It's the kind of elevated heart rate, that tachycardic type sensation where the heart rate rises really quickly. And obviously with POTS, that's to do with postural changes, so going from laying to sitting to standing, and the changes that occur sometimes when people aren't doing anything at all, that their heart rate is just rising rapidly, which is of course really scary. And I love the fact that you mentioned fear, and obviously fear in the way that you were contextualizing it in terms of belief is not helpful, but actually fear is a very real thing, because the body needs fear if our heart rate is rising. That to the nervous system is signaling there is a threat, there is something going on that is creating a sense of unsafety in the body. So actually that is a very real physical experience that will create those symptoms that are then sometimes dismissed as, well, that's just anxiety. No, it isn't. This is something happening in my body that I can feel is very, very real. So I think it's really reductionist to just go, well, it's an anxiety because you're stuck in your fight or flight, response of your nervous system, because there are real reasons for that. The body is, trying to recover from a virus that is very complex, multifaceted, has over 200 symptoms that we know of, and is not well treated at this time in terms of the treatment pathway that's out there. So it's really misunderstood. All those things, even the fact that this is misunderstood and so often dismissed, funny enough, they create fear because we need certainty to feel that we are safe.
So unpicking that a little bit further, so our fear and our stress response, the fight-flight response, is there to keep us safe, isn't it? And it comes from, us being animals, and animals will, when they're nice and happy and grounded, will not, they'll be in this kind of safe space, and then they get sort of a trigger, and then they'll sort of go into this fight-flight. I'm sensing that.
I really want to kind of unpack that a little bit more, because yes, we are animals, but actually we're really badly designed if you think about it. And I kind of have this kind of ongoing joke with the people that I work with, that we're probably worse designed than hedgehogs when it comes to survival, right? Because when we're born, we're unable to survive without another person. And that is how we can start to kind of explore the nervous system and how it impacts us. And I know we kind of, maybe I mentioned earlier, past experience, but actually when we start to look at the nervous system, we have to take into account how our nervous system was shaped. And that tends to be in our early years. And remember, I want to say from the outset, the nervous system, the autonomic nervous system, is working and doing its thing automatically. Okay, we don't have kind of control over the nervous system until we bring conscious awareness to certain areas of it that mean that we can access some of it. So this is all going on under the surface, which is why I think it's so important that we acknowledge the body and the nervous system response in terms of our recovery. Because when we start to understand how our nervous system might have been shaped early on, we can kind of get some like aha moments, and we start to feel that we can maybe understand why there might be that sense of unsafety in the body, because our nervous system from a young age is very adaptive. Obviously, the nervous system is designed to be adaptive. We have this kind of baseline that is there as our kind of homeostasis, the place that where we function most effectively, where our body systems are functioning most effectively. And actually, that's a really important thing to understand when we're looking at recovery, because that is also where we feel safe or safest. Now, when the nervous system is being shaped, we obviously feel stress. And when I say stress, I don't mean, the Amazon man hasn't arrived, this is outrageous, I'm really stressed. I'm talking about how our body interprets threat to our system. And that can be various different ways that we might interpret that, but that sends our autonomic nervous system response into that fight or flight place where we are then kind of feeling unsafe. So there is a threat physiologically to our system. And that is the place where if we are continually fighting a virus or the body is kind of under threat physiologically, we can end up kind of feeling very stuck in that fight or flight place. But that is the signals from the body alerting us to a danger or a threat in the body, which is...
It's an appropriate response. That's what
it's an appropriate response. It's an adaptive response. Absolutely. Yeah.
So I have patients who say, I don't feel anxious in my mind, but my body feels anxious because they're tapping into the dysautonomic and they're told they're anxious and they're like, but I'm not anxious. On a conscious level, I don't feel anxious, but my body is feeling anxious. And I think this is where this whole thing of anxiety gets very mixed up.
I know. I kind of want to change the word of anxiety, because actually when I look at that with people, if we look at it as what is your body communicating to you through that feeling of anxiety, what we commonly term as anxiety, it's an alarm system going off. It's something is telling us something doesn't feel right. And yeah, you're right. People might not feel that there's anything going on consciously, but remember, a lot of what we experience in life and how we respond to is actually going on under the surface in that unconscious way. And I'll give you an example, perhaps. If you meet somebody and you're having a chat with them and you just kind of feel like, something doesn't feel quite right, that's your gut instinct kicking in. It's like when we're walking down the street at night, there's that unconscious awareness that we stiffen up, we kind of feel ready, because there might not be a threat. There might not be, somebody threatening us. Yeah, exactly. But there's that unconscious awareness that's signaling from the nervous system that we need to be ready for threat. And I think it's also perhaps really important to mention that this is not psychological. This is very much rooted in the understanding that our nervous system and our brain are working predictively as well, which I think is another element that kind of comes into recovery focused therapy, is understanding how we can become kind of stuck in that fight or flight response. Because if the system is predicting threat or fear or whatever it might be, illness as well, then that can also keep us in that space of fight or flight activity in the nervous system.
Yeah. So there's so much to talk about here, kind of almost like I want to go off on 15 different tangents, but let's go back to the early life experiences, because there is this sort of, I have some patients who do not see a connection between what's previously happened before, say, the COVID infection or the vaccine injury or whatever it was they're suffering from. And they go, but on the 25th of March, 2020, I got infected with a virus, and that's when I got ill. So I don't really see how experiences are relevant here. And I don't think we need to, ignore that. And and I can understand that perspective. Like, where do you sit sort of with that?
I think it can be a really uncomfortable kind of feeling. We're kind of live in this society where we're told, we just need to move on from stuff. We need to move on quickly from things. We don't need to dwell on the past. There's a lot of toxic kind of positivity out there, kind of move on. But actually, sometimes it's the understanding and awareness that help us to shift from that unsafe state in the nervous system to the safer place where recovery takes place, right? Because recovery doesn't take place so easily when our system is feeling threatened in that nervous system response. If I may, I'll talk a bit about those kind of earlier years in terms of, because our nervous system is shaped pretty much when we're a child. And by shaped, I mean, that's how we start to understand who we are in the world, how we respond to things, and how we learn to respond to things, including ourselves, in those early years, based on what's going on around us and who we're with around us. So the other thing is that, sorry, I'm going off on tangents now. It just occurred to me that this condition will never, we talk a lot about nervous system regulation being needed. And I want to say that we're not taught regulation. We're not taught it in schools. I think maybe a little bit more so now, perhaps. But actually, if we think about how we regulate ourselves, we tend to learn that from other people. We learn that from the people around us. And we might have grown up in places, spaces with people where they themselves weren't regulated. And our nervous systems interact with other nervous systems. I always say to people, what's the best thing for your nervous system? And it's actually another person. And then I say, and what's the worst thing for a nervous system? It's another person. Because our nervous systems interact with other nervous systems. So if we go way back, in fact, do you mind if I draw this? Because this is what I do sometimes with people.
Well, sometimes it helps. Some people listen and don't watch, so as long as you're explaining what you're doing.
Yeah. So this is going to be not the best drawing, I want to just say from the outset, okay? I'm going to show my age here massively by saying this would never appear on the gallery wall of Tony Hart. Anyway, yeah. Thanks for not leaving me hanging there. Yeah, exactly. So if we look at, I'm just going to move this bright light out of my way. If we look at our nervous system, and this is going to be basic, so I'm sorry. We've got this kind of like baseline, like I was talking about, really not straight baseline. That is homeostasis, right? It's the place in the body where everything wants to work most effectively.
Balanced.
Yeah. The balanced place, the calm place. And our nervous system is adaptive. So it is designed to be able to move in and out of this baseline, taking us into the stress response because it's adaptive, because we need to have that stress response in the body to go to that fight or flight place because it's necessary for survival. So when we're younger, when we're born, we have this, we don't have very many tools at our disposal and we can't regulate ourselves. So we have to rely on another person. And so we go into the stress response because we're cold, wet, hungry, whatever. Mum or dad or caretaker comes along and regulates us back to safety, back to our calm place. This is ideal, right? This is the ideal version of what happens. Of course, stuff comes along in our lives and stress happens again. But what if stress happens again and again and again? So I'm going to call this this is our fight or flight. But in effect, what I tend to end up calling it, this is the unsafe place, right? This is the place where we feel unsafe in our bodies. And we might experience that as hot, sweaty palms. We might experience that as those tachycardia type symptoms, that, racing heart rate, our breathing will get faster. We will experience perhaps feeling really clammy, those kinds of overthinking thoughts, we're racing thoughts, we can't think clearly, we're not focused at that point. This line down here is our safe place. This is the calm place. Breathing is nice and calm, blood pressure is nice and balanced, heart rate isn't fluctuating massively. So say we encounter things in our life that create physiological stress over and over again, which when we're talking about our early years would be viewed as early life experiences, adverse early life experiences. And now feeling unsafe can come from many places. It doesn't mean that there's a bear at the door about to attack us. It can mean that we are not feeling properly seen or heard in the home. And by that, I mean, maybe there are emotions that we're not allowed to feel. We might start to suppress who we are. That, would you believe, is also felt to our nervous system as a threat, because it is a threat to our survival, because we need to feel that we are being seen, heard, and accepted in our homes. But say things happen time and time again, the stress response never really truly gets back to this baseline. And that creates almost like a new baseline in place, which I call kind of like it's like an adaptive new baseline. Sometimes I call it a place of fake safety. Sometimes I call it a sense of safety. We get this sense that we're okay, but actually we're living then in this fight or flight energy, which is, of course.
Can I just say here, and this doesn't need to be like trauma. You don't have to be abused to get these.
Not at all.
You can have a lovely, caring family and still experience these micro stresses. And
exactly,
it's about there's a lot of stuff that feeds into this. It's the community you're brought up in, the belief systems your parents have, our
society.
Get on with it, pull your boots up,
exactly. Exactly. Our society, wants us to move on quickly from things. It wants us to be able to get back into work quickly. It wants us to kind of be able to do all these things and keep pushing on through,
Yeah.
And that's that space where we find ourselves in fight or flight a lot, with that cortisol and adrenaline coursing through our systems more frequently than not. And that's without that. This is our early life, right? So for most of us, this would have been without the experience of long COVID or another chronic health condition coming along. But yeah, you're so right. We seem to suggest that trauma is something massive, but actually what we're talking about is things that overwhelm our system, which can be very small things, but frequently. And it's not to place blame on someone, and it's also to remember that what we need is co-regulation, and that might not be available, and that's not anyone's fault, because they themselves may not be regulated themselves. So until we have, I guess what I'm trying to say overall is, until we have an understanding of the nervous system generally, but also of our individual shaping of our nervous system, then we don't necessarily take it into account when we look at recovery. And what's really important to mention, I think, as well, is the way that we approach our recovery is so often the way that we've approached our lives. And the people that I meet are some of life's most wonderful people. They are the empaths, they are the givers, they're the carers, they're the people out there kind of constantly doing, spinning so many plates. And that is an adaptive response to stress, that kind of keeping going response, that I need to please everyone and put everyone else's needs first. That's an adaptive response to physiological stress, to that feeling of unsafety in our bodies.
And that heightened baseline, the fake safety place, from a medical, physiological sort of perspective, scientific perspective, there's lots of cortisol flying around.
Lots of adrenaline.
Adrenaline, it's pro-inflammatory, it suppresses the immune system. That's one where people are overworking, they're more prone to infections and things. So it almost makes people predisposes people then to having perhaps a worse response to the COVID infection.
To illness, to viruses, to COVID,
and your immune system then can't adapt necessarily to fix it in a way, because it's continuously under stress, under these stress hormones. So I'm just conscious of time, because suddenly we're like 30 minutes in and there's loads of really good questions coming in.
Can I just add, though, what I really want to say about that is that's no one's fault. I want to reassure and reconfirm that this is all going on, right? This whole nervous system thing is going on under our conscious awareness. It's not our fault that we are going into the stress response. The world around us, and specifically, I think when we're talking about long COVID, we need to also mention that the pandemic was a time when we were all feeling that the world was unsafe.
Absolutely, yeah. And so if we want to start, and I know we can't do this in 10 minutes before the questions, but if people want to start not undoing it, but understanding it and working on it, and recalibrating and regulating their nervous system. They're often told, go and do some yoga, do some mindfulness. And I have people who go, do you know what? I've done the mindfulness, I've done the yoga, I've done the cold water therapy, it's not working. Give me the drugs. And I'm kind of like, yeah, you know, but so sometimes it's the way in which the message is given to people to go, right,
Yeah.
you need to do mindfulness, fix your nervous system,
Mm.
and then it doesn't work.
Yeah, I mean, I come across this all the time, that doing yoga, practicing mindfulness can be helpful, but it's not going to cure a physical condition, which this is, right? Because this is so many things going on. I think that it's easy for people to say, that, you know, try this. But ultimately, as I said, what I tend to see is that people approach their recovery in the same way they've approached life, which is keep going, you know, keep pushing through, keep trying everything, the doing of everything. And actually that tends to overwhelm the system. And funny enough, what does that do? It pushes us back into that fight or flight energy. So we remain stuck because our brain, our nervous system, isn't looking at a long list of well-being activities as anything other than what resources am I going to need to get through this long list of activity. So it's not seeing them as this will be beneficial for me. It's looking at it like this is a lot of things that I'm going to need. The to-do list, exactly the to-do list. Yeah. And also when we look at it like that in terms of nervous system regulation, we might be bypassing the very kind of things, the patterns that are within our nervous system that might be kind of contributing to that stuck space, that kind of adaptive safety space, because we're not looking at the coping mechanisms that we might have been using, which might be the constant doing, constant kind of overachieving, constant pushing on through. I mean, hello, hold my hands up, you know, self-confessed plate spinner. And, you know, I really had to learn about that myself, you know, to not do that, because that was really keeping me very stuck. And so coming back to your question, it's not that those things can't be helpful, because they can be, but I think it's a very kind of simplistic view to say when perhaps diagnostic tests come back and they're not showing anything, and they're kind of like, the doctor might end up going, have you tried yoga? And it's like, well, that's not going to help in this situation, is my, in the way that, you know, when we look at yoga and the way that we currently kind of view what is, for most of us in this country anyway, you know, yoga classes, they are not helpful for people with long COVID. They will end up not listening to their bodies, pushing on through and doing far too much for their system, because we're not addressing what might be disconnecting them from their bodies in the first place, which is these kind of coping mechanisms that we adapt and use to survive that feeling of unsafety, that threat response.
In terms of recovery, because you're a recovery focused therapist, and I know you do use yoga therapy, but not in the sense of the Western interpretation of yoga, which is doing like, you know, really hard poses. Yoga is like this entire massive Eastern philosophy, isn't it, which has got multiple strands, and there's many different types. So so we don't have time to go into all of that. But so, you know, is it talking therapy? What is, how do people, because people will be watching this going, okay, so what do I do?
Yeah, what do I do? How can I recover? Yeah. So I'd say, first of all, we need to really make sure that people are on the right treatment pathways, and that they are being treated holistically. My part of the recovery process is to support people in their recovery with the understanding of how their nervous system has been shaped and the patterns that might be at play that are currently, you know, they might not be aware of, that can be kind of non-supportive to recovery. So keeping them away from that safe space. And this is why I think saying things like, try mindfulness, try meditation, try yoga, you know, when you've got a lot of cortisol and adrenaline coursing through your body, the idea that you're going to have to focus your mind and somehow like clear the mind and be able to do yoga, especially with this condition where we know, you know, yoga as we see it in the West is absolutely not what we're talking about here. Yoga to support therapeutic rest, yes, absolutely, that can be really, really beneficial, and there are a lot of really good practitioners out there that are very understanding of this condition, and I would definitely urge people to look for somebody who truly understands this condition if they're going, if they're looking in that direction. But to expect somebody who's stuck in fight or flight activity in their nervous system response to somehow be able to immediately regulate themselves and find a calm space through things like mindfulness, meditation, yoga, etc., is almost like saying you can just change your mindset and then you'll be fine. And that's just simply not true, because this is not a mindset thing. This is a very real health, physical condition.
Yeah, and I think I'm going to get into some of the questions now. Actually, I'm going to bring Helen, because there's loads more that we had sort of badged that we were going to talk about. But I think there's some really, really good questions coming through, and I want to give time to these questions. So Helen, I hope you're ready. I'm just going to bring you back on. And I know you've been keeping an eye on the chat, and if we can't answer the questions, we'll just say we'll have to find out and get back to people.
Yeah, thanks everyone for the questions. Lots and lots of really, really good questions. I'll start though with one from myself, because as we all know, it's the Long COVID Clinic, What You Can Do is the title of the channel. So I would say, going back to basics here right now, what are the top tips for things that you can do right now? So for example, and everyone's different, we all know this. no two people are going to be helped by the same thing. I personally do find yoga nidra, for example, so amazingly great for settling the nervous system before sleep, and massaging the ears, things like that. But what are like really cheap or even free, even better, and easy things that we can do now that might help, and it's worth a try?
Well, breathing practices are very well known, obviously, especially amongst this community. I think the way that we approach breathing needs to be supported, because again, if we approach it in the got to get this right, must get this, this has to be perfectly done in this way. And my approach specifically with breathing is very much about going right back to basics and kind of becoming just aware of the breath, a very gentle breath that signals safety and calm to the body. We're not looking at pushing anything that starts to push us back into that unsafe space in the nervous system, back into that fight or flight activity. And remember, even things where we feel like, oh no, I've got to get this right, oh no, I've failed, that's doing that, that's perpetuating that cycle. So we really want to come right back to basics with how we approach kind of our recovery, in terms of even when we look at how we approach the breath, really, really gently, with a lot of compassion. And look, I'm saying these words, but I want to say this is not easy stuff, because most of us don't have a lot of self-compassion. We have a lot of compassion for everyone else and a lot of energy to give out, which is the, empaths, that kind of energy to give out to others, to put others' needs first. But when we turn that mirror back on ourselves, it can be really, really difficult to do that. And I think it's really important that we support people in their recovery, to understand that a big part of it is to actually treat ourselves really, really kindly, even in the trying to recover space. In fact, that's the most important part. We can learn so much about ourselves there.
Yeah. Great, thank you. Binita, was there anything you wanted, or shall I carry on?
There's a couple of questions about functional neurological disorder. Now, Nadine, this might not be your area of expertise.
Definitely not. I'm going to pass you over.
It's not my area of expertise, but what I would say is there's a lot of people who are getting diagnosed with something called functional neurological disorder, when their neurological symptoms are not explained by, they have the neurology tests and they're all normal. I have got many patients who have been diagnosed with this who have got better. Their symptoms have got better with treatment. you know, and treating their POTS and treating their mast cell activation, whatever else is going on, their neurological symptoms do improve. I've got one patient who was diagnosed with FND by the St. George's very, very, very specialist team in London. I was really skeptical about the diagnosis, but this guy, he lost the use of his legs. And actually he has done really well with the neurophysiology support. So I think, like with everything, you know, FND is a thing. I personally feel like it's being massively overdiagnosed in long COVID because we don't understand long COVID, but there isn't research to really go, well, this is FND, this isn't. And because we haven't characterized long COVID properly with proper biomarkers and proper diagnostic tests, these labels get slapped on people, and then they're quite hard to get rid of once you've got the label. And if everyone with FND got really good care and went to a centre where there was neurophysiologists and neurologists who understood, you know, and worked with patients in a rehabilitative kind of way, or maybe some people would do quite well with that, but often people get slapped on with a diagnosis and discharged, and it's not very helpful. So I think it's a mess, to be honest, the whole FND thing. But I'm not an expert in the condition, so I'll massively caveat that.
Yeah, can I interrupt? Can I ask, what did that treatment plan look like? Because it is something that is spoken about a lot, and a lot of people will be coming to this because there's an understanding within the community that it's down to like this.
Yeah, I can't really go into the details of it. I don't know is the honest answer, but I am in touch with the guy's mum, and he's doing really well. Right. He's still really ill, don't get me wrong. He's still got lots of inflammation, lots of other stuff, but there probably was an FND element to his condition, so it can coexist with other things. I don't think it is the explanation for most of the neurological type symptoms we're seeing in long COVID. That's my personal view. I can't back that up with evidence-based research, but that's just from my own experience. But it's a great question. But I think the problem is, like Sonia has said, it becomes more like a psychosomatic issue and then treated like that, which isn't helpful a lot of the time. Helen, there's this one.
Yeah, so with the POTS type symptoms, the nervous system malfunction, fight-flight link makes sense. How does this relate to the ME/CFS side and feeling like you can never get restorative sleep, which I'm sure so many people relate to?
Yeah, absolutely. Well, you know, in POTS, obviously, part of the POTS diagnosis takes into account that kind of tachycardic element and the nervous system dysregulation, but that's not to say it's not part of the long COVID ME/CFS side of things too. And nervous system dysregulation is a big part of illness in general. You know, that inflammation is creating that sense of threat to the body. So we need to take that into account. And I think it's why can't we get restorative rest? Yeah, I mean, that's such a massive question. For many of us, we don't feel we deserve it. We might have some patterns going on that might be keeping us kind of perhaps feeling like we can't have that. We might need to kind of almost find permission for that, which takes some time, I think, to understand. But also remember, the body, when it's dysregulated, it's got a lot of adrenaline and cortisol, and that's an energy that is like a kind of, I remember one, you know, somebody that I was working with calling it like the buzz. You know, it's a really buzzing kind of energy. It's a real, very visceral, felt sense in the body when we feel tense and in that fight or flight energy. And then to say to somebody, you just need to rest, that's like saying to somebody with asthma, you just need to take a breath. Well, that's very easy to say, but not easy to put into practice. And there are reasons why we can't, you know, to regulate ourselves, to down-regulate the system. Number one, it needs to be gentle. When we're working in a nervous system friendly way, we need to do it gently. And so many approaches are kind of that short, sharp shock treatment. That's not necessarily helpful to people when we're looking at how we down-regulate the nervous system to get that restorative rest. So it's about, again, coming back to treating ourselves really, really gently and understanding perhaps why those patterns in the nervous system, because the nervous system holds imprints of previous experience. And of course, this, being unwell, is a scary, horrible experience. And we need to honor that in a way, that it is that. And that's, of course, going to impact our nervous system. So, of course, it's not easy.
Yeah. Can I ask, so, and I was going to ask this next anyway, organically, but it kind of moves on to it in a good way. There are many questions coming in as well about neurodivergence, ADHD, things like that. And also, if you look at like the cortisol, adrenaline surge, it's very well known, of course, with like things like ADHD, it's very difficult to get sleep. You literally can't turn off your brain, and it's almost like people with ADHD or that type of condition are more likely to have heightened symptoms if they've got the long COVID type chronic conditions going on. They almost kind of egging each other on type thing, and you end up in this ridiculous cycle. What things can we do to go back to our catchphrase to kind of break that cycle and kind of get back to a more regulated version of yourself type thing?
I think
without medication and going down that route.
Well,
or does it need to be
that is for some people it will, of course, and that's really important that we address it in that holistic way. That for some people it will, and it needs to, and they need to be able to access that. What things can we do for ourselves? Well, I do think we need to come back to how do we initially in our lives regulate, and that is via another person, and there needs to be a sense of safety. Now, for everybody, if I were to say, you know, how do you know when you feel safe? That can be a question that can be really hard to answer for people. They might not have that experience necessarily to hand. They might have an idea of what it could feel like, but they might not have experienced that in their body, that sense of the body feeling safe, because our nervous system responds to so many things, people, places. It doesn't have to be that we are persistently under threat, you know, constantly under threat, but we can feel that we might be because we are in a kind of pattern within the nervous system, a kind of that stuck space where down regulating to that calm space is really, really challenging. And actually, I think in order to get there for so many people, it does require support, because I think it requires understanding, and that's not easy to do alone. And I know that therefore means that, you know, so often people have to seek treatment, support, etc., outside of themselves. But, you know, we're not necessarily supposed to be able to do everything alone. And I think it's really important that we can offer that to people, so that they can understand themselves better. But I would say the first thing is to really be very gentle with ourselves and actually try not to notice those thought loops of beating yourself up because, or feeling like you're failing at, or I can't do this. You know, notice those types of things as well, because they too are kind of not helping the nervous system to come down.
Jump in there if it's okay?
Please
you
do.
mentioned about doing it alone and having another person. Can I be very specific in what you mean by that? Because obviously in an ideal world you'd have a family member who is like that reliable other person. Not everyone's going to have that.
Yes.
And do you mean like healthcare professional? Do you mean advocacy, like a charity, therapy?
All of the above. All of the many things that you've mentioned. I want to give you an example, and we've probably all been through this space if we've come through, you know, with this condition. When you sit in front of a doctor who listens to what you're saying and truly gets what you're saying and reflects back to you what you've said, and you feel understood and you feel finally somebody is listening to me, that down regulates the nervous system.
I think that's the tricky thing with this condition, is that so many people, the normal response is to not get that.
The opposite, exactly. And the constant advocating that we do for ourselves and other people, you know, the explaining of ourselves with this invisible, for many, condition. And that is contributing to this nervous system space. But when we have some compassion for that, for ourselves, that also can be really, really helpful, you know, rather than what so many of us do is that we turn that blame inwards. We blame ourselves for not recovering fast enough, or for not being understood, and that is really unhelpful too.
Yeah, I mean, of course, you can be like, oh, well, everyone else got this, everyone else didn't get ill like me, but that's not useful. Not everyone else had the same starting point, and not everyone's got the same circumstances. But what I will say is there is lots of things that you can do that's not necessarily, if you don't have the privilege of having that, person in your life, or whatever, that experience. It's a postcode lottery with doctors. We all
very
know
much
this.
so, very much so.
There is, if I can flag, you can do things like journaling, which is very useful. It's just you then. You don't need to have, you can do it anytime, 24/7, and get those thoughts out. You can do voice notes if your eyes are bad. There's lots of different things. There's the peer support groups. So with the Long COVID Support Charity, we do check-in and chats. So you can log on. It's completely free, and you can speak with fellow patients, and you can have that general understanding, maybe pick up some tips, but just kind of have that to and fro with someone who does understand. There are
having a community. Yeah, being part of the community can be really helpful in that regard, for sure. I want to say pets as well.
I nearly said it was on the tip of my tongue.
They're really important.
I'd say.
Some people use religion in a very similar way. There's lots of different ways of kind of having that self-meditation kind of outlet to kind of get your thoughts and gather them and make sense of them and regulate them and get yourself into a calmer place. But it's not the full picture. That's not going to suddenly heal you, but it will give you the grounding.
Yeah, and I think that's really important. It's finding things that really nourish you and support you in it whilst you're navigating recovery. It's
whilst
really
you're
important.
in the battle.
I have so many patients, particularly women, who are trying to play the role of mum and look after their elderly parents and work and be ill and run a household. And it's just like there's no space or time for that self-compassion, and that especially caring for a child. A lot of long COVID runs in families, as we know. So sometimes these women are sick, not just women but men as well are sick. They're also looking after a sick child.
Yes,
so that
child exactly.
always come first. There is never that space. So these are really challenging sort of things we're asking people to do, and I think it's important that we acknowledge that as well. It's not easy. Like if I could just lift everyone out of their life, put them on a desert island with a guru who could do all of this stuff all day every day with them, maybe people would get a lot better. But that's not.
I think we can find like micro moments. I talk about micro moments a lot in my work, because this is about acknowledging where we're at. And I really try not to use the word battle. I try not to use this fight, because as soon as we get into a fight with what we're experiencing, we're pushing us. The system, our nervous system, is pushing us back into that place where we don't feel safe in ourselves. And remember, this is not to blame anyone for this, because this is, as Binny says, really hard. Now, I'm a mum caring for a child with long COVID. I myself have been through various symptoms of long COVID and have to manage that as well. And I work, and I know I'm not the only one out there doing that. And I'm very much, this is hard. This is where we don't go down the toxic positivity route, because that is absolutely not helpful at all. And it's really important that we acknowledge that our nervous system is constantly responding to the world around us, which is in itself a challenge. So then to be in it with this kind of condition, which is so frequently dismissed and misunderstood, is again another huge challenge to the nervous system. And even if we can find a micro moment, and it can be small because it's going to be individual for everybody, but it can be sitting outside for a moment, just feeling the sun on our face, or moving our chair if we can to the window. And for people that are bedbound, I know this is really hard, because for some of us, we are not able to do even the movement to get to that place. But this is where different types of techniques can come into place. visualizations, etc. All this, there's lots of things out there, but I think that the way that we approach them needs to be really gentle. And I know that's not even easy, because we're, like you were saying, for so many of us, we're in what feels like a battle with our bodies.
Well, I use that as an empowerment thing, actually. I'm in control. I'm not the victim. I'm in control of that, you know, positive mindset around it. But it's entirely how it's framed, of course.
Yeah.
I'm conscious of time again, and sorry, Nadine, I know in the therapy space this is going to be like, well, I've got all these questions to get through, and I want to get through them all, but there is one I want to bring up. I absolutely want to put this to bed. I want this, you know, we said let's not swear. This kind of, I don't want to swear at you, Leanne. I want to swear at the fact that people have told PEM is a fear, you know, a fear of, it's about fear of exercise and doing nothing. It's not. Can I just say, PEM is a theological, measurable phenomenon which is very well described in the scientific literature. It is to do with how well we use oxygen in our muscles. And if I use the analogy of a car, like if you know you've only got so much fuel in the car, if you drive it like a maniac down the motorway all day versus drive it, you know, 30 miles an hour around a town, you're going to do more damage, you know, to the engine driving it wrong. Not driving it wrong, but driving it in, you know, if you're advised to drive it in the wrong way. The body is like that, that if you overspend the energy continuously because you're told that you've just got to push through the fear and get out of bed and go for a walk, if you know that can cause real harm. And actually the approach is really about rest and nurturing yourself back to health through different approaches. There was a great question earlier about what do you think about neuroplasticity techniques versus all the, you know, the monitoring of visible? That's a really great question, because for some people, all the monitoring will cause stress. And for other people, it's brilliant. It keeps them out of that PEM. So you know, this is a whole area that needs a massive amount of research and support in managing PEM. And this idea that it's just about fear makes me really angry. Dr. Kane's getting angry now.
Yeah,
sorry,
it's really annoying. It is very annoying because, as I said, and I've said the whole way through, this is a very real physical condition with measurable symptoms. So this is not just the fear of not doing anything or fear of doing too much. There's reasons why our body and our nervous system, you know, is reacting in these ways. Oh, we love this question.
So this question, can long COVID patients recover totally, or is this a lifetime? Do we need to pace till the end of life, end of time? This would be a really great one to finish on. I've got so many other questions. Maybe we need to do another session, Nadine.
Oh gosh.
I'll let you recover from this one first.
Yeah, no, you know, I'd love to. I would love to, genuinely. I myself consider myself recovered, but I manage my patterns. Now that's very individual to me. I know people that I've worked with that have recovered, that they are out there, you know, climbing bloody mountains, some of them, which is amazing, because when I first started working with them, they were, you know, bedbound. So yes, I do believe that, but that I know that there are some schools of thought out there that if you recover, it means you never were really ill. But you know, that's not true. That can't be true, because our state of health changes constantly, because we change constantly. Things around us change constantly, and the recovery can be navigated, and it does require, you know, a lot of things that are, as we've spoken about, that are historically not available or have been you know, people have been sent down pathways that haven't been helpful for them. And I think that this is such a huge topic, but my personal opinion, my clinical experience is that yes, recovery is possible.
Yes,
Binny,
and I'd agree with that. I'm seeing recovery in some patients. My daughter's recovered. Like, she's 90, I would say she's not 100% in the sense that she's not doing athletics and sprinting and things like that, but she's completely recovered. She was about at 40 to 50% at her worst function. So she couldn't really walk more than 100 meters. She was housebound, didn't go to school for a year. but she has completely recovered. And I think she could do athletics if she trained in the right way to manage that increase. She just wouldn't go and do it straight away. You have to retrain your body to do things. It's got to be managed.
Even in recovery, I think management is still important, because we learn so much about ourselves in recovery as well. We might learn about new ways of being, new ways of doing things that actually manage our energy levels better, because for many of us, we might have been surviving in that space of kind of do constantly for a really, really long time, which isn't sustainable for the nervous system anyway, regardless of illness. But then we add illness to that and the dysregulating effects of it. And of course, that's going to push us into that space where recovery is harder. And like very passionate about this, my heart goes out all the time to people, because this is complex, this is complicated, and it is really difficult and challenging. It
is. And I think this is kind of a nice one to finish on, because we are just slightly over the hour now. And I just wanted to finish on this. This is a question from Randeep about how much of a role mind-body approaches could work with, in treating other illnesses where there's immune dysregulation, like rheumatoid arthritis. Once you know about autonomic dysregulation, you can't unsee it in every other condition. So once I got into this world, and then I'd go and do my NHS clinic, and I'd be like, oh my God, this person with really severe breathlessness problems, who, their lung function's fine, their CT scan's fine, but their breathing pattern is very dysregulated. I think it's relevant to all chronic illness. It really is. Yeah. And for some reason, long COVID and ME have been singled out in this space as, people just want to say it's psychosomatic, which is completely different, by the way. But I think it's a great question, because I don't know what your thoughts are, Nadine.
I absolutely think that, working in lots of different areas, but where chronic health conditions are present, I think when we have a deeper understanding of our unique nervous system response to certain things, we can really grow in awareness of what can be helpful for us individually. But as a general, our nervous system is interconnected to our immune system. So, of course, these things all play a part. We are not a series of parts. We are a whole person. And I think that that's a really important understanding for health and general well-being. So I would say for every condition, every time we feel unwell, our nervous system is responding to that.
Yeah. Final comment. Sorry. I try not to go over too much, but there's too many good comments. I think this is truly the last one we're going to finish on.
I was actually going to speak to this before we even finished, but
yeah.
But go for it.
What can we do as a community to counteract and fight the all-in-your-head rhetoric that is incessant and so harmful? We hear you, Amajit. We really do, because it's an epidemic within medicine. This.
Yes. It really, really is. And this is why I apologize so frequently, because doing the job I do, it is inevitable that people are going to think I'm thinking that it's all in their head. It's not in anyone's head. This is not in anyone's head. It's something that we are experiencing in every way. But to simplify it as something we're in our head, this phrase all in our head seems to signal and symbolize that we are making it up, that it isn't real. And I think this is something that happens in so many conditions that aren't seen. Nobody says to somebody with a broken leg, that's in your head, but because we can't see it and it might not be there on a diagnostic, that doesn't mean that your lived experience isn't very, very real and happening physically to you, in you. So what we can do as a community, well, advocacy doesn't take any energy, does it? So, I'm being really flippant there. We can, as much as I'd like to say, it's our job as a community to educate people, and there are elements of that. We also need to recognize that takes so much energy, the constant advocacy for ourselves and this condition is exhausting. I think we need greater understanding in the medical community. I think we need greater understanding in society. And I think the more people that, what's been really interesting to me in this work is, see, working in healthcare, is that when the doctors and the pediatricians and people, and I worked specifically with a pediatrician who herself, felt absolutely terrible because she herself has long COVID, but had spent years dismissing the condition. And I think, we need more people to stand up and say, this is a very real condition. This isn't all in our heads. And that rhetoric really has to change, because it is so incredibly harmful for treatment and recovery.
Thank you, Nadine. Go on,
if it's
Helen.
okay to speak as well to this as well, because I actually was going to say some of this as part of my end words anyway, was bottom line, ignore it, because if it's not part of your journey, then don't make it part of your journey, and that is so difficult, but acknowledge that it is to a certain degree. You can do what you can do in regards to leveling your system, breath work, etc., like all the good stuff we've spoken about, but it's not the full picture, and if you do have the energy, do join the community and trying to change this, like Long COVID Support, the charities, one of a few charities. Long COVID Kids does amazing work as well, Long COVID SOS. There's lots of amazing people around the world, not just in the UK, doing amazing stuff. Get involved if you have the capacity to do so without it impacting your health negatively on a personal level, because that's not going to help anyone. Put your own mask on first, like on the plane, but metaphorically speaking. But yeah.
It's a really important point to make. It's hard to ignore, but sometimes, we have to put, all the time, especially with this condition, we have to put ourselves first. And that's super important, because for many of us, we would have spent a long time not doing that. So this is it. Yeah. Really
I've also just put in the chat, I haven't been able to go onto a web link and get the web link, but if you put into Google the Bateman-Horn clinical care guidelines for long COVID, ME/CSF, and infection-associated chronic conditions, or I've put it in the chat, then there is a brilliant new guideline that's been published from the States, from the Bateman-Horn Centre, which is leading in this area, which if you take that to your care provider, they would struggle very hard to say this is in your head, because it's absolutely brilliant. It's the best thing I've seen. So please do download that if you need a bit of a backup, and send them our videos. That's the other thing you can do. Well, what a brilliant session. Thank you so much, Nadine. Thank you to everyone watching, because that's been the busiest chat we've had for a while, and we've not got to most of the questions, actually. There's really great ones. So but you might be back by popular demand, but I'm going to call it there, because we've gone over quite significantly. I'm probably going to have a break now for the summer, but we'll hopefully be back with the Fireside chats in September. So thanks for watching, everyone, and have a lovely summer, and we shall see you on the other side. Take care. Bye-bye.
Thanks, everyone.
Thank you. Thanks so much, Helen and Binny.